Good evening, ladies and gentlemen. May I start by apologizing for being a bit late. A flight that was supposed to be at 2:30 left a few minutes before 3 o'clock this afternoon. Sincere apologies for that. My name is Nandi Mayathula Khoza. I'm from the Central Drug Authority, Honorable former President and Chairperson of the East and Southern Africa Commission on Drug Policy, Honorable Kgalema Motlanthe, Honorable Minister with us, TB HIV Care, Sanput, the organizers of this policy week, as well as your partners and funders, and I'm not going to mention them by name in the interest of time. Government departments who are represented today, other civil society organizations, South Africa's provincial and local drug action committees, community members and key populations, members of the media, distinguished guests. May I, on behalf of the CDA, congratulate the organizers and your partners for this well-organized Africa Policy Week 2023 with an inspiring theme, Putting People First, which builds on the statement issued by the UNHRC, calling on all countries to end stigma, end discrimination, and put people first. Let me just start by quoting the late Mr. Kofi Annan, who once said, and I quote, "Drugs have destroyed many lives, but wrong government policies have destroyed many more." And I hope the situation is changing. It is therefore imperative for the country's policies to be developed with empathy, understanding, and a genuine commitment to the people they serve in order to eradicate stigma and discrimination. Addressing substance use situations also demands a united, a coordinated, and a comprehensive effort by government departments, civil society organizations, people who use and inject drugs, healthcare professionals, and communities to stand together to challenge the prevailing stigma, discrimination, criminalization, poverty, and inequalities. Criminalizing people who use drugs increase stigma and marginalization, acting as a barrier to education, employment, health, harm reduction, and psychosocial services. Our mandate as a Central Drug Authority is to oversee, coordinate, and monitor the implementation of the National Drug Master Plan. As I entered, the speaker was making reference to this blueprint that provides strategic direction to the country's efforts to deal with the use and misuse of substances. It sets out national drug policies and priorities to manage substance use disorders. I'm not going to talk about its vision, its goals, and mission in the interest of time, but we are mandated to advise government as a CDA on policies and programs in the field of substance use and drug trafficking. As such, we are most of the time consulted by government departments who develop public drug policies with the aim to amend legislation that does not assist in eradicating stigma and discrimination, and that is not people-centric. In collaboration with the multi-sectoral stakeholders, we therefore ensure that drug policies, strategies, and programs that are developed and implemented are scientific and evidence-based, human rights-based, people-centered, inclusive, participatory, multi-sectoral, and multilateral in line with the National Drug Master Plan principles and our country's constitution. In essence, policymakers are advised to align all the public drug policies to the National Drug Master Plan and the country's constitution, as well as to the 2030 SDGs, and to move away from the punitive approaches which have not been successful in tackling drug use-related challenges. This is to ensure safety and well-being of the target groups, which would include the vulnerable young people, children, women, including pregnant women, people with disabilities, occupational groups at risk, and key populations, including the LGBTIQ, sex workers, migrant workers, people who use and inject drugs, including people who are incarcerated in prisons for possession of small amounts of drugs. In the interest of time, I wanted to share with you some of the positive steps that are being taken by government of South Africa, but I've been asked to be short so that I allow our important guest to speak. But there's quite a number of those, and just for example, Government is developing a policy on the prevention of and treatment of substance use disorders with the aim to amend the 2008 Act to adhere to the above-mentioned principles and the people-centric approach. And Correctional Services is taking steps to promote a policy on alternatives to punishment and incarceration for minor and first-time drug offending, and for young women, especially pregnant women and mothers engaged in illicit drug trade because of their situation of vulnerability and poverty. We are also working together with partners and stakeholders addressing the issue of incidences of HIV, hepatitis, TB, and STDs amongst people who use drugs. So I'm not going to elaborate, safe to say that government has committed itself, but the process is very slow. As a CDA, we are nudging those departments that are responsible for, for harm reduction programs, including the OST, needle and syringe programs, but the whole comprehensive program to reduce harm amongst people who take drugs. And I'm going to leave it there. As CDA, in the interest of time again, we thank you very much. We thank the organizers for this opportunity to say a few words to open as an opening statement, and we wish you all the best. Thank you.